Greetings to all the respected dignitaries. I am Aishwarya Jain. I would like to extend my heartfelt gratitude and thank you for giving me a chance to speak. The topic of my presentation is Introduction to Liquid Dosage Forms, Classification and Definitions. A drug may be defined as an agent intended for use in diagnosis, mitigation, treatment, cure, or prevention of disease in man or other animals. Drugs are rarely administered in their original pure state. They are administered in different dosage forms after converting them into a suitable formulation. Dosage forms may be classified on the basis of physical form of the final product. There are different types of dosage forms, such as solid dosage form, liquid dosage form, and semi solid dosage form. Today, I am going to give more emphasis on liquid dosage form. Liquid stage forms are meant for internal, parenteral, or external use. They are available in monophasic or biphasic forms. The dosage forms offer exclusive advantages to numerous patients, like for example, in patients facing problem in swallowing oral solid dosage forms, liquid offer better compliance for the patients and also provide enhanced dosage control against the fixed dose of the tablet. Now we will see the advantages of liquid oral preparations. It is easier to swallow liquids than solid. Thus, these dosage forms are more satisfactory and suitable for pediatrics and geriatrics. Solutions get absorbed easily, thus producing therapeutic response at a faster rate than the solids. In case a drug precipitates from the solution form under acidic condition of the stomach, it will become moist and will divide into fine particles, allowing rapid absorption. The drug in the liquid dosage form is uniformly distributed. If a drug is administered in solution form, gastric irritation is reduced as it immediately gets diluted by the contents present in the gastric area. On the other hand, there are some disadvantages of liquid dosage forms, which are the transportation and storage of liquids are problematic as they are bulky. Any container breakage if occurs during transportation, the whole formulated product is lost. The ingredients and liquids are liable to deteriorate and lose their potency, thus they have limited stability. This is the reason why liquid dosage forms have shorter shelf life. Growth of microorganisms is supported by liquid media, thus the preparations needs a preservative to be incorporated within it. Dose inaccuracy may occur if a patient takes a dose using household devices like a teaspoon, etc. The dissolved substances in the liquids may result in incompatibility interactions. Classification. Liquid dosage forms on the basis of their phases are classified as liquids, which are subdivided into monophasic and biphasic. Under monophasic, it is again subdivided into aqueous and non-aqueous. In biphasic liquid dosage forms, they are subdivided into emulsions and suspensions. Monophasic liquid dosage forms refers to liquid preparations in which there is only one phase. It is represented by true solution. A true solution is clear, homogeneous mixture that is prepared by dissolving a solid liquid or a gas in a liquid. The components of solution present in large amount is known as solvent and the component present in small amount are known as solutes. Monophasic liquid dosage forms are classified into two groups. Liquids meant for internal administrations, examples are syrups, elixir, solutions, Lynxis and throat paints. Liquids meant for external administration and the examples are lotions, gargles, mouthwashes, eye drops, ear drops, nose drops and liniments. Biphasic liquid dosage forms. So these liquid preparations are having two phases are termed as biphasic liquids. These preparations essentially required a dispersed phase and a dispersion medium in order to dissolve many insoluble solid and liquid medicaments that are either soluble or immiscible with the water. Following are the examples of biphasic liquid dosage form. First is emulsion and it consists of oral, external, parenteral and ophthalmic preparations. Second is suspension, in which there are external, oral, parenteral, and ophthalmic preparations. Under monophasic liquid dosage forms, firstly we will learn about solutions. Solutions can be defined as a homogeneous system made up of a phase containing two or more components, usually dissolved in water. There are various types of solutions. First, as depending on the type of solvent, in that aqueous solution and non-aqueous solution. Second, on the basis of site of administration. Examples are oral solutions and topical solutions. And third is solutions instilled into the body cavities and parenteral solutions. The advantages of solution are they have rapid absorption and they do not cause damage and irritation to the GI tract. Next, under monophasic liquid dosage form, we will learn about syrups. Syrups are saturated, sweet, viscous, concentrated solution of sucrose in purified water. The concentration of sugar is 66.7% weight by weight according to Indian Pharmacopoeia. Syrups are classified as simple syrups. Syrups containing therapeutic or medicinal agents are called medicated syrups, while syrups with flavors but no medicinal agents are called flavored or non-medicated syrups. Syrups are prepared by using hot process, percolation method, and agitation without heat. The various advantages of syrups are that it retards the oxidation, it prevents decomposition of many vegetable substances. Syrups have high osmotic pressure which prevents the growth of bacteria, fungi, molds, and they are palatable due to the sweetness and act as an valuable vehicle for the administration of nauseous and bitter drugs. Syrup should be stored at temperature not exceeding 25 degrees Celsius. Elixirs are defined as clear, sweetened, aromatic, hydroalcoholic liquid intended for oral use. The main ingredient of elixir are ethyl alcohol, which is in the concentration of 5 to 40%. Water, glycerine, or propyl glycol is also used. Elixirs are classified as medicated elixir and non-medicated elixirs. The medicated elixir usually contain a potent drug such as antibiotics, antihistamines, or sedatives. The storage of elixirs the elixirs are required to be stored in a cool place protected from the light. Next, Lynxis. Lynxis are viscous liquids and oral preparation that are generally prescribed for the relief of cough. They contain medicaments which have demulcent, sedative, or expectorant action. Lynxis should be taken in small doses, sipped and swallowed slowly without diluting it with water in order to have the maximum and prolonged effect of the medicament. Lynxis are stored in cool place protected from the light. Lotions. Lotions are liquid preparations meant for external application without friction. They are applied directly to the skin with the help of some absorbent material such as cotton wool or gauze soaked in it. Lotions may be used for local actions as cooling, soothing, or protective purposes. They are generally applied for antiseptic action. Example is calamine lotion. Alcohol is sometimes included in aqueous lotions for its cooling and soothing effect. Example is salicylic acid lotion. Lotion should be stored in well-filled, well-closed in an airtight container in a cool place. Mouthwash. Mouthwashes are aqueous solutions with an pleasant taste and odor used to make clean and deodorize the buccal cavity. Generally, they contain antibacterial agents, alcohol, glycerine, sweetening agents, flavoring agents, and coloring agents. The label should clearly indicate the proper direction for diluting the mouthwash before use. Also apply the secondary label that is for external use only. Gargle. Gargles are aqueous solution used to prevent or treat throat infection. They are usually available in concentrated form with direction for dilution with warm water before use. They are brought into intimate contact with the mucous membrane of the throat and are allowed to remain in contact with it for few seconds before they are thrown out of the mouth. They are used to relieve soreness and mild throat infection. Phenol and thymol are generally present in small concentration for its antibacterial activity. Potassium chlorate is also included in gargles for its weak astringent effect to tone up the relaxed throat. It also stimulates secretion of saliva, which relieves dryness. Liniment. The liniments are liquid or semi-liquid preparation meant for application to the skin. The liniments are usually applied to the skin with friction and rubbing to the skin. Liniment should not be applied onto the broken skin because it may cause excessive irritation. Liniment should be stored in tightly closed airtight container in cool place. Ear drops. These are solution of drops that are instilled into the ear with a dropper. The solution is generally prepared in water, glycerine, propylene glycol or diluted alcohol. However, vehicle like glycerine and propylene glycol are preferred. These are generally used for cleaning the ear, softening the wax and for treating the mild infection. They should be used for external use only and stored in cool and dry place. Nasal drops. Nasal drops, these are aqueous solutions of drops that are instilled into the nose with dropper. The oily vehicle is not used nowadays because oily drops inhibits the movement of cilia in the nasal mucosa and if used for long period may reach to the lungs and cause lipoidal pneumonia. Nasal drops should be isotonic with 0.9% NaCl having neutral pH and viscosity which similar to the nasal secretion. Nasal drops should be stored in cool place. Eye drops. These are a sterile preparation meant for installation into the eye in the space between the eyelid and eyeballs. These products must be sterile and prepared under the same condition and by the same method. The labeling conditions should be maintained like for external use only and discontinue if irritation persists. Storage must strictly followed like once open the bottle it should be used within 30 days and after that the formulation should be discarded. Throat paint. Throat paints are viscous liquid preparation used for mouth and throat infection. Glycerin is commonly used as base because being viscous it adheres to the mucous membrane for long period of time. Throat paint should be stored in airtight container in a cool place. Liquid preparations having two phases are termed as biphasic. In that first we will see emulsion. A biphasic liquid preparation containing two immiscible liquids, one which is dispersed as minute globules into the other is termed as pharmaceutical emulsion. The liquid in the form of minute globules in dispersed phase while liquid containing the dispersed globules is called continuous phase. The advantages of emulsion are inedible oils, unpleasant taste or odor of oil such as castor oil can be easily administered as emulsion. The obnoxious taste of oils can be concealed. They are more rapidly absorbed than solid dosage forms. There are two types of emulsions, water in oil emulsion and oil in water emulsion. Emulsions are prepared by using dry gum method, wet gum method and bottle methods. An emulsion should be stored in airtight container protected from light, high temperature or freezing. Emulsions are required to be stored in cool place. Suspensions. Suspensions are biphasic liquid dosage forms of medicaments in which a finely divided solid particles ranging from 0.5 to 5 microns are dispersed in liquid or semi-solid vehicle. Advantages of suspensions are it is easy to swallow these suspended insoluble medicaments, it has taste masking, it has improved stability, prolonged action of dosage forms, and enhanced bioavailability. Suspension should be stored in cool place but should not be kept in refrigerator. Freezing at a very low temperature should be avoided which may lead to aggregation of suspended particles. These are few multiple choice questions. Thank you.